Hi friends, good evening and welcome to my channel. Today we will see some points which will help for exam. We will see first point, deficiency of vitamin C. Vitamin C is also known as ascorbic acid, which may cause scurvy, delayed wound healing and weakness. So deficiency of vitamin C cause scurvy and delayed wound healing and weakness. And the next point, deficiency of vitamin B1. B1 is also known as thiamine. Thiamine causes beriberi. So vitamin C is cause scurvy and vitamin B1 cause beriberi. And the very next point, deficiency of vitamin B2. B2 is also known as riboflavin. So riboflavin causes angular stomatitis. And stomatitis means inflammation of the mouth. So deficiency of vitamin B2 riboflavin cause angular stomatitis. And the very next point, deficiency of vitamin B3. B3 is also known as niacin, which cause pellagra. Pellagra is also known as 3D disease, that is dermatitis, dementia and diarrhea. And the very next point, vitamin B5 is also known as pantothenic acid and vitamin B6 is also known as pyridoxine. And the next point, deficiency of vitamin B7. B7 is also known as biotin. So biotin deficiency cause dermatitis and hypercholesterolemia. That is vitamin B7. And the next point, vitamin B9. Deficiency of vitamin B9. B9 is also known as folic acid, which may cause megaloblastic anemia, glossitis and chelosis. So deficiency of vitamin B9 cause mainly megaloblastic anemia. And deficiency of vitamin B12. B12 is also known as cyanocobalamin, which cause megaloblastic anemia and degeneration of nerve fibers of spinal cord. And the next point, digestion of carbohydrate and protein start in mouth and digestion of fat start in stomach but occurs mainly in small intestine. Digestion of fat mainly in small intestine. And the next point, Bilirubin 1. Bilirubin 1 is a surgical procedure, is also known as gastroduodenostomy. So Bilirubin 1 procedure, mainly the surgical procedure for peptic ulcer, is also known as gastroduodenostomy. Next point, Bilirubin 2 is a surgical procedure, is also known as gastrojejunostomy. Bilirubin 1 is known as gastroduodenostomy and Bilirubin 2 is known as gastrojejunostomy. And the next point, normal pulmonary artery systolic pressure is 15 to 25 mm of Hg. It is systolic pulmonary artery systolic pressure, and normal pulmonary artery diastolic pressure is 8 to 12 mm of Hg. And the next point, Stilwell sign is an infrequent or incomplete blinking of the eyes. Mainly this is a sign of Graves' disease. So infrequent or incomplete blinking of eyes is called Stilwell sign. And the next point, Oliver sign. Oliver sign, a pulling sensation in trachea, is a pulling sensation occurs in the trachea. It is mainly due to aneurysm of arch of aorta. Aneurysm means abnormal enlargement of artery. Due to that, there is a pulling sensation in trachea. And next is Mercer sign. It's a rhythmical jerking of the head. It's a rhythmical movement, jerking movement occurs in the head, mainly in aortic aneurysm and aortic insufficiency. Oliver sign and Mercer sign. And the next point, Coccus hemostatic forceps is used to clamp umbilical cord. And the next point, headache, disturbed sleep and oliguria are the alarming sign of eclampsia. So what are the alarming sign of eclampsia is headache, disturbed sleep and oliguria are the alarming sign of eclampsia.